Hi everyone, today we'll discuss MCQs on parathyroid glands. So, primary hyperparathyroidism is caused by parathyroid hyperplasia, yes, adenoma, yes, and Mcqs syndrome, yes. Thyrotoxicosis, you don't see hyperparathyroidism, and chronic renal failure, you see secondary hyperparathyroidism and not primary. So, option A, B, and C are correct. Removal of parathyroid hyperplasia is removal of all four glands. No, it leads to permanent hypocalcemia, which is not done. Calcitonin, not the treatment, and removal of 3.5 glands, and enlarged glands to be removed only in cases of parathyroid adenoma, not in hyperplasia. Parathyroid adenoma most commonly involves which of the following site? It most commonly involves inferior parathyroids. Features to differentiate parathyroid adenoma from hyperplasia. The difference between the adenoma and hyperplasia is hyperplasia involves all the four glands, enlargement of all the four glands, whereas the adenoma involving one or two glands. So, the other features are the presence of excess chief cells are seen in both, high levels of parath hormone seen in both, and infiltration of capsule is seen in carcinoma rather than adenoma or hyperplasia. True about parathyroid carcinoma. Parathyroid gland is palpable, yes, it will be usually more than 3 cm. High calcium level more than 12 milligram per deciliter. Cinacalcet is used for calcium, reducing the hypercalcemia. So, all of the above is correct. In case of parathyroid adenoma, treatment is calcitonin and steroid? No. Removal of adenoma? Yes. Total parathyroidectomy and implantation in the arm, that is carried out in hyperplasia and not in adenomas. And total parathyroidectomy is not done. So, the option is B. Kamali Rani, 75-year-old female, presents with post-myocardial infarction after 6 weeks with mild congestive heart failure. There was past history of neck surgery for parathyroid adenoma 5 years ago, and ECG shows atrial fibrillation. Serum calcium is 13 and urinary calcium is 300 mg per 24 hours. On examination, there is small mass in the paratracheal position behind the right clavicle. Appropriate management is, so the patient is right now not stable, so neck surgery is not the option. Treatment with technetium-99, it is only for the diagnosis and not for the management, for the treatment. Observation and repeat serum calcium in 2 months, no, since she is in arrhythmias. So, ultrasound guided alcohol injection of the mass would be correct option. Commonest cause of hyperparathyroidism is always a single adenoma. Most common cause of hypercalcemic crisis is most commonly seen in metastatic or metastatic malignancy, so it is carcinoma breast. Hypoparathyroidism occurs as a result of idiopathic atrophy of parathyroids, no, some amount of parathormone secretion will be there, so that's wrong. So, following surgery, mainly the total thyroidectomy where there is ischemia or injury to the parathyroid glands results in hypoparathyroidism, and thyroiditis will not cause hypoparathyroidism. So, option B. Hypoparathyroidism can occur in after thyroid surgery, yes, total thyroidectomy, Dye-George syndrome where there is no development of the thymus and the inferior parathyroid, yes, and radical resection of the head and neck cancer, yes, and Mcqs syndrome, you see hyperparathyroidism and not hypoparathyroidism. So, option A, B, and C are correct. Hypocalcemia in immediate post-op period following excision of parathyroid adenoma is because of increased uptake by bones, that is known as hungry bone syndrome. Hungry bone syndrome due to sudden drop in the PTH level, so the the osteoblastic activity will increase and there is more and more uptake of calcium into the bones. That is why patient will have hypocalcemia. In parathyroid crisis, the sudden elevations of calcium over 16, the treatment consists of, it is only the options are whenever the patient is in parathyroid crisis. So the what and all management you give is, you give normal saline and Lasix, that is nothing but the furosemide. Furosemide is a loop diuretic. Furosemide is a loop diuretic which causes increase in calcium excretion. So these options are wrong, but you can take only one option, that is parathyroidectomy for removal of adenomas. This is for dehydration and this is to increase the calcium excretion, and you can even give zolendronate. Zolendronate is nothing but a bisphosphonate which will reduce the osteoclastic activity. Hyperparathyroidism is characterized by the following except generalized osteoporosis, yes, renal calculi, yes, and hypercalcemia, yes. Osteosclerosis, that is not seen, so the option is D. So the classical symptoms of primary hyperparathyroidism, the renal, nephrolithiasis, nephrocalcinosis, polyuria, polydipsia, skeletal, neuromuscular, gastrointestinal and neuropsychiatric and cardiovascular complications are listed here, and this is the chart from Sabiston. A patient has hypocalcemia which was the result of surgical complication. Which operation could it possibly be? So the option is thyroidectomy. The symptoms of hyperparathyroidism include constipation and muscle weakness, yes. Anorexia and weight loss, yes. Polydipsia and polyuria, yes, because of dehydration. So all of the options are correct. A known patient with renal stone disease developed pathological fractures along with abdominal pain and certain psychiatric symptoms. So the patient is having primary hyperparathyroidism. Hypocalcemia is feature of all of the following except chronic renal failure, you have hypocalcemia, and hypothyroidism, yes, and pseudohypoparathyroidism. Pseudohypoparathyroidism is an autosomal dominant disorder where there is a resistance to PTH. So resistance to PTH which leads to low calcium levels. So since there is resistance to PTH and there is low calcium levels, the body sends it as a low calcium levels and starts increasing the parathormone secretions. So it is called a pseudo hypoparathyroidism. Since there is low calcium and increased PTH, so the condition is known as pseudo hypoparathyroidism. So total thyroidectomy, patients might have hypocalcemia that can be transient or sometimes it can be permanent. But most of the patients after total thyroidectomy recover from hypocalcemia and can still be normocalcemic. So option D is the answer. So which of the following is true about secondary hyperparathyroidism? So commonly occurs in chronic renal failure, yes. Related to hyperphosphatemia, yes. Since the kidneys are not able to excrete the more phosphate, so phosphate starts building up in the body and they start combining with the serum calcium to form the calcium phosphate and reducing the calcium levels, and even the vitamin D productions by the kidneys are also reduced. That is one of the cause for hypocalcemia. Patients are generally hypocalcemic, yes, all of the options are correct. So parathyroid gland was implanted into forearm muscle. What is the type of or transplantation? So it is heterotopic. So orthotopic, if you implant it into the same position of the same anatomical position, it is orthotopic. Auxiliary is nothing but you keep a part of the diseased organ and transplant into the same site, it is auxiliary. Heterotopic is into the different site. Parathyroid autotransplantation is done in which of the following muscle? It is non-dominant brachioradialis. A young female with a history of renal calculi complains of bone pain, abdominal cramps. On investigation, there are multiple fractures, serum calcium and PTH were raised. Which of the following will be the best investigation? So, the investigation of choice is system EB scan, because all are going towards hyperparathyroidism. So, we need to localize the parathyroid glands, which is more sensitive is system EB scan. And radioiodine is for the parathyroid and CECT is not used. Ultrasound neck has low sensitivity compared to the system EB. Which of the following is the least sensitive for parathyroid imaging? So, all these are used for parathyroid imaging, but the least sensitive is MRI. So, MRI accounts for only about 43%. MRI accounts only for about 43%, whereas compared to the ultrasound it is 76%, whereas the system AB is 79%. So this is the most sensitive investigation for parathyroid imaging. And coming to the symptoms, signs and symptoms, you can go through this table. Both of these tables are from Sebastian. Thank you.